Good afternoon. Welcome to MCPHS Online, which is part of MCPHS University, formerly known as Mass College of Pharmacy and Health Sciences. My name is Barbara McCauley. I'm the Associate Provost and CEO for Online Education at our university. It's really a pleasure to have you join us today. We know you have many choices, so I'm glad that you chose us. And we think we have a very good presentation that will be informative for you. I would like to ask you to hold your questions to the end of our formal presentations. We will be taking a Q&A session at the end of the formal presentations. I would like you to know that the programs that we're presenting today, which are listed on this first slide, are basically our premier online graduate programs that are non-clinical. In that sense, they don't have any clinical requirements. In other words, we do have other programs, roughly 18, that are available to you from our website. You can take a look at them. They do have some clinical components, and others are undergraduate programs. But these are the ones that we chose to feature today. I do have some wonderful colleagues joining me today. The first person who will be speaking to you is Dave Mantis, who heads up our Regulatory Affairs and Health Policy program. Then we will be joined by Mike Spooner, who's actually going to be representing 3 program areas: healthcare administration, public health, medication, and patient safety. And last but certainly not least is Dr. Robin Harvin, who will be presenting on the Doctor of Health Science program and the Master of Health Sciences. So with all my introduction aside, I'd like to be able to now introduce you again to Dave Mantis.
Thank you, Barbara. And it's my pleasure to spend some time this afternoon discussing with you our graduate program in Regulatory Affairs and Health Policy. As Barbara said, my name is Dave Mantis. I'm the director of the Regulatory Affairs program and also an associate professor here in pharmaceutical science. I want to point out that I only joined full-time MCPHS University in January of this year, but prior to that I enjoyed a 14-year relationship with the university as an adjunct, while also completing a 22-year career in the biotechnology and pharmaceutical industry. I mention that because I believe our Regulatory Affairs and Health Policy program is unique in that it combines industrial expertise, practitioners of the art, along with academics. Before I talk about our program in Regulatory Affairs, I always like to introduce the field of regulatory affairs, or the profession of regulatory affairs. What is regulatory affairs? And I've used this analogy, and others have. It's about navigating a path. That path could be from the idea of a device to an actual physician using that device to help a patient. It could be from a professor's lab at a university to testing a drug in a human being for the first time. If these pathways were drawn on a map and clear every time, we wouldn't need regulatory affairs professionals. But they're not. They require an interpretation of history, of regulation, of laws, and of science. And it's that aspect of it that makes it a profession that is both valued by the industry, but also relatively rare, and something that requires and is ripe for training, like in a master's program. It also requires an understanding of a broad array of expertise, including, for example, research, development, business, the regulations, and law. It's that complexity that makes it interesting, makes it an important function within industry and within academics, but also, in my mind, makes it fun. What makes the MCPHS Regulatory Affairs program different? I think there are 3 factors, and I'm going to go into those in some level of detail. One is our faculty, which is second to none. Another is the flexibility of our program that allows you to create your own program at your own pace and to complete the program in a variety of different ways, essentially to navigate your own path. The future that the completion of the program gives you is the third aspect of the program I'll get into. And it really is becoming and part of a network of alumni that has a 15-year history. Let me tell you a little bit about our faculty. When they are full-time academics, such as myself, Almost all of us have prior industry experience, often measured in decades. We have several full-time faculty at MCPHS University that teach in the program, either core courses or electives. We also borrow staff from Harvard University and Tufts University as adjuncts. I want to talk a little bit more detail about our industry leaders who teach in the program. These are our adjuncts. All have 10+ years of industry experience. Many, if not most of them, have 5+ years experience teaching at MCPHS University as adjuncts. They come from companies large and small as individual consultants, as large as Shire or Genzyme. They come from government agencies such as HHS. These industry leaders bring to the classroom practical problems and contemporary problems. Issues they see every day in their work as regulatory professionals, they bring to the classroom. This combination of industry expertise and academic excellence is one of the reasons I consider our faculty unique and second to none. What about flexibility? This list that you might not be able to see lists all of our regulatory affairs classes. These are simply the classes that are the core to the curriculum and our electives. They're not the only classes that you can take at MCPHS in order to complete your regulatory affairs program. All of these classes are offered online and on campus. They're also offered in an array of scheduling, meaning spring and fall, and we've even expanded our summer offerings this year. We have 2 certificate options leading to the MS degree. If you take the classes in the right order, you'll build up the 3 classes necessary for a certificate, for example, in regulatory affairs, and this will count, this classwork will count toward your eventual master's degree. We also offer a wide variety of electives within the regulatory affairs program, but you can also take them in other programs. For example, in pharmacoeconomics, and you can take, not only can you take electives in pharmacoeconomics, you can even take enough to have a minor in pharmacoeconomics. But we also offer a minor and electives in other courses, some of which you'll hear about today, and in pharmaceutical science, where we also offer a minor. We offer both the option of not doing a thesis and completing your master's, or doing a thesis. The thesis option I often recommend to students who have no prior industry experience because it gives them a written work product to discuss with potential employers. It may also get published or presented at meetings depending on the quality of the work and the nature of the work. These options are entirely up to the student, and we also offer thesis advisors who are either full-time faculty or can work in industry and provide guidance and advising for your master's thesis, should you choose to take that option. Lastly, I want to mention the schedule. You can finish at your own pace. If you choose to take a full set of course loads, coursework in the first, in over 3 semesters plus the summer, you can actually finish in 14 months. Most of our students take on average 2 classes a semester and finish in a 2 academic year cycle. But you can set your own pace and finish at whatever schedule suits your schedule. For example, if you're a full-time employee. Lastly, I want to discuss the future that a regulatory master's from MCPHS will give you. We have a 15-year history of graduating master's students, and they've ended up at companies that are included in this slide, and this is a partial list. We have graduates who are now employees at some of the largest pharmaceutical and biotechnology companies on earth. They are employed in North America, Europe, and Asia. They work at tiny companies that are just startups. They work at the Food and Drug Administration, both in the US and in Saudi Arabia. We have graduates who are at the level of Vice President of Regulatory Affairs, but also graduates who work in clinical research, legal, and in research, and in the research lab, and then we actually have patent attorneys as well who studied with us. This is the future that a master's degree in regulatory affairs and health policy at MCPHS opens to you. It represents your future path. And I hope you consider seriously joining us. And if you have questions, as Barbara said earlier, we're going to save those for the end. I'd like now to introduce Mike Spooner. He's Director of the Healthcare Administration Program here at MCPHS University.
Thank you, Dave, and thank you all for joining us here today. I'm excited to have the opportunity to speak with you, albeit not exactly in person, but close enough. As David just mentioned, my name is Michael Spooner. I'll be talking to you actually about the Healthcare Administration Program, in addition to a few others that we have here in patient safety, medication management, as well as the public health program, where I'll be stepping in for the director who is on maternity leave at the moment. So it's important for us to think about the career path and what the MHA, or Masters of Healthcare Administration program, was developed for. And it was really developed for leadership and addressing a lot of the medical and health services needs that we see developing in our ever so complex healthcare environment. And for those of you who are affiliated with any sort of healthcare organization, you understand that we're managing facilities, patient practices, clinical areas, and departments of research in some cases, and we have to determine some of the strategic goals and aims for our organization. And we have to really do this in what we would call a multi-talented, in a multi-talented pool of, Anyway, we're looking at a multi-talented pool of employees that we can pull from, but what we're looking for in this case is we're looking for leadership, and we're looking to understand the organizational dynamics that are occurring in the environment of healthcare, managing innovation and change. And we're looking to inform our decision making to make sure that we're making a decision based upon the foundations that are occurring in health policy, and looking at the ways that our operational leadership is being used. Are we using quality management tools in the right context? And are we using these to prepare and predict systemic change? These are some of the ways in which we have to address healthcare and healthcare management in the current environment. So the Masters in Healthcare Administration is developed to prepare you for careers in healthcare management. And what we're looking at in terms of employers, we've worked a lot with our employers, and we've worked a lot with the Healthcare Leadership Alliance competency model to determine what is the appropriate level of education, where do we need to focus, and what experience are our employers in the environment looking for. And in general, we can say we know that there's a desire for healthcare experience. There's a desire for communication skills. There's a general management component as well, which we talked about a little bit earlier in terms of, are we making the right decisions? How are we informing our decisions that we're making in our organization? And how are we planning for the future? There's no question that planning in healthcare is one of the most important aspects of our jobs and in our daily business. And we certainly need to think about this not just only in a quantitative method, but in a qualitative as well. And so we're talking about the character with which we approach the decision making that we undertake on a daily basis. But we cannot forget that we are involved in healthcare and delivering healthcare to individuals. And there's a very specific reason why healthcare is important to all of us. It's one of the most important decisions, or and some of the most important things that will be on our mind for most of our lives. So as we talk about all of these reasons to join this profession, let's also think about some of the career options. And in particular, the 2012 median salary was a very good median salary, just over $88,000. The number of jobs created in 2012 was over 315,000. And that's a growth rate of roughly 23% within this industry. So we can certainly see that there is some opportunity here for healthcare leadership and healthcare management. So we'll talk a little bit about the program itself. It's a 36-credit program, and this allows a lot of flexibility, which is something that Dave mentioned earlier with his program. It allows you to complete the program at a part-time level, which is 2 courses per semester. And it allows you to complete that within 24 months. And so the curriculum itself is laid out in a manner that meets a lot of the competencies that we were just talking about in terms of leadership and decision making and communication skills as well. So this is definitely a curriculum that has been designed based upon what employers are looking for, preparing you professionally for what you need and meeting some of the competencies that are extremely important. So I mentioned the healthcare leadership competency model. This model is designed from a group of 7 different organizations that put together their best thought in terms of what they need from employees in the management area. And so you'll notice that it's more than just a model. At the center of the leadership competency model is, of course, leadership. But leadership is informed by 4 different areas, which include our business skills and knowledge, our knowledge of the healthcare environment, and our ability to communicate and develop relationships within our organizations and outside of our organizations as well. Because what you'll find is healthcare administration is driven by profession, and is a strong professional relationship that is developed among not just institutions, but among the entire profession. And so that the final component is professionalism. And so what we're talking about again is coming back to this idea of leadership. And leadership is not just leadership in the sense of making a decision or picking up from one place or another. We're talking about having the ability to lead from a skills perspective, to understand that organizations and cultures have particular needs and values, and being able to communicate that vision and manage change in a healthcare organization. So again, we come back to this perspective that healthcare management is not just management, it's operations, it's health policy and analysis, it's understanding quality of care, using analytics, finance. And so there's a lot of components that we're talking about. And so this is where the profession of healthcare management comes together in terms of this program. I'd like to, Now, I'm going to switch gears here a little bit, and as I mentioned at the very beginning of this presentation, I will be stepping in for Carly Levy, who's the director of the Masters of Public Health program here at MCPHS University. It's an online program as well as face-to-face, and so this is, again, another example of where we can offer flexibility in terms of our programs. So I'm excited to be able to speak with you today about public health. I'll be introducing the profession of public health. I'll give you an overview of the profession. I'll be talking about the curriculum and the ways in which this curriculum fits together within the profession, your needs as a student, and the outcomes that employers would be looking for. So I'll first go into public health versus clinical health. Sometimes we can easily intertwine the two, but public health is generally based upon the population and whole health of the population. So if you want to think of it as disease prevention or prevention and health promotion, where clinical health is typically individual, focused upon disease and diagnosis and treatment of that disease. So some of the top 10 public health achievements that we have seen in our lifetimes include vaccinations, increased motor vehicle safety. I know I'm one of the few people who can think back to when cars didn't have airbags, but airbags are an example of how motor vehicle safety has increased, not only because we used epidemiological perspectives to find this, but we've created a safer vehicle to travel in. We've identified issues within workplaces and organizations like OSHA. We've created the ability to control infectious diseases, and we've seen a decline in deaths related to preventable occurrences such as coronary heart disease. We've created safer and healthier foods as a result of public health. And we've created healthier opportunities for mothers and their children. Family planning, fluoridation of public water is another example of where public health has changed dramatically the oral health of the public. And we also talk about the recognition of the health risks of tobacco as another opportunity for public health and health promotion within. So going back to what the profession really is, public health is a multidisciplinary and practiced in a variety of settings, including local, state, and federal and international levels. Public health includes so many different aspects of healthcare, of policy, and it brings together a lot of this exciting information, including epidemiological studies. And has anybody heard of the Affordable Care Act? I mean, certainly that is a huge example of where public health has, in some respects, influenced policy here in the United States. So we also know that there's a shortage of public health workers, rough estimate of 250,000. So, well, it's a good time to be in public health, isn't it? There are certainly benefits to working in public health. Let's think about the degree first. This is a professionally oriented degree that brings you toward practice in public health settings. There are job opportunities that occur in this kind of area in a number of different areas. Again, we have local and state health departments. We have managed care organizations. We talked a little bit about the Affordable Care Act, and that brings up the idea of accountable care organizations and medical homes. We have community-based organizations and nonprofits that are doing a lot of work not only in the community, but in terms of health promotion as well. Hospitals are certainly looking for public health practitioners, consulting firms, international non-governmental agencies, and then we all, again, come back to the state and federal agencies. And no matter what track you take within public health, there's certainly a complement to clinical health and to non-clinical components as well. So public health careers, again, it comes back to the idea that this is a professional degree, and we're doing this for a reason. And it's typically to expand our career, but to do it in a very flexible way. And that's where we see the online education coming into this particular element. We're talking about public health in terms of education, in terms of administration and management, in terms of policy, community practice, and research. These are all very viable areas for public health careers. The curriculum is a 42-credit program. It is almost entirely online. There are certainly opportunities here to take courses face-to-face now that we have a face-to-face program starting this fall. There are no prerequisites for the program other than a bachelor's degree, an earned bachelor's degree. And we have a concentration that is offered in community health, which is certainly a hot area given the influence of the Affordable Care Act and the need for community surveillance. So the core courses of this program include a survey of public health, statistics and clinical research, health epidemiology, environmental health, health policy and management, social and behavioral science focuses as well. Our concentration includes 12 core courses, or 12 credits in core courses, as well as elective courses, which includes 6 credit hours or two separate elective courses you may take. And it ends with a culminating practice experience, which is 6 credit hours. The culminating experience includes a practice requirement, which is 120 hours, which is essentially 8 hours per week for one 15-hour semester. And you must have approval from your faculty advisor before commencing this portion of your program. And what you'll be working with an on-site preceptor in this case to overview or guide your work within a particular setting. You may complete this practicum with your current employer, but it must be different than your everyday role. And you may also be paid or unpaid for this particular role. It depends on how that role is found. And it's important to note here at this point that MCPHS does not provide a stipend for this particular piece of your study. We also talked about how we're working this culminating experience in a face-to-face manner. So there'll be one 5-day semester or one 5-day intensive offered here on campus. It's always in the summertime, which hopefully allows for you to travel and plan accordingly. It gives you the opportunity to meet and network with your fellow students, to meet faculty, and to enjoy the beautiful Longwood Medical area. You have an opportunity also to complete this culminating experience and synthesize and integrate our 5 core disciplines of public health, which are included in the application of theory and experiences gained through the program. This gives us opportunities to review empirical research, and it's really just a way for you to sum up your entire education here and bring it together in one culminating experience that gives you access to public health and is a very good way for you to finish off. I'm going to change gears one more time here on you, and I'm going to shift into patient and medication safety. Medication safety is a 12-credit online certificate that we do here at MCPHS online. And patient safety is a 36-credit online master's degree, again, offered through MCPHS online. And these two programs go hand in hand because The first portion of the patient safety program is derived from the certificate in medication management. So there's a program emphasis here on quality and safety in medication practices. And one of the things that you've certainly heard in the news over the past few years is this idea that we need to increase the quality of healthcare that we have and what we're receiving in terms of medications. And there's certainly this idea that there's a huge amount of complexity occurring. And so we need to manage that. And so this idea of medication safety and patient safety come together in this idea of increasing quality and also bringing together a focus upon our communication in quality. So we're applying tools and analytical approaches to solve clinical problems. This gives us a systems focus, which is on this idea of a safety culture. We talk about environmental factors that lead to errors and how we deal with errors in medication as well as in patient safety and quality. And we look at the ways in which effective change leadership strategies can be used. And this is, again, a career-focused, project module-based program that gives us this wonderful approach that includes our experienced faculty here from MCPHS University, from our pharmacy and other areas. And we also focus primarily on an implementation approach. In other words, we're developing these modules for you to go back out into the environment of care and implement this as a safety measure, improving quality, and doing what I think is one of the most important aspects of healthcare, which is this whole idea of a culture of safety and bringing this back to a systemic focus. So you might be thinking, who would do this degree and why? And so again, it comes back to this idea that we are looking for people who want to make a difference in healthcare. Healthcare is certainly one of the areas where we have opportunity to make a huge impact in terms of quality and safety. But it also comes back to the idea that pharmacists, nurses, maybe BSN or master's prepared nurses, or physician assistants, and other clinical and non-clinical practitioners may want to take part in this degree because it offers an opportunity to develop a professional focus, and it offers this professional focus in a flexible, less committed, non-clinical way. We also offer everything here online in this particular program, and it gives you the ability to do your coursework on your schedule, which is sometimes the flexibility that a healthcare professional needs. We also talk about the opportunity that comes in here because these certificate courses can be directly applied, and this is again for the the medication safety program. The certificate courses can be applied directly to the master's in patient safety, and it can be completed in just an additional 22 semester hours. So the curriculum for the medication safety management certificate is driven from 5 courses that focus on introducing quality and safety, and then we move on to medication safety, communication and the team approach, as well as error reduction or medication safety tools, analysis and application. And finally, there's a longitudinal project that is worked through all of these focuses to develop a solution and apply that within your particular setting. So the Masters of Patient Safety is a little bit different. Again, it begins with those certificate-based courses. It brings us into a professional focus on occupational health and safety specializations. Medication safety officers and coordinators may be interested in doing this particular program. And again, it's a professionally focused program that allows patient safety specialists the flexibility to complete a program online. We talk about safety challenges a lot of the time, such as wrong site surgeries, medication errors, nosocomial infections, patient falls and injuries that occur while in care, readmissions that come from these particular injuries, diagnostic errors. And some of you may even be aware of reports from the Institute of Medicine, such as To Err is Human, which indicated that as many as 98,000 deaths per year occur as a result of a medical error. So these are some of the important aspects of medication and safety, medication management and patient safety. And so again, it comes back to this idea of providing a professionally focused degree that can be practiced in ambulatory care settings, skilled nursing facilities, and other healthcare focused institutions. So the curriculum for the Masters of Patient Safety is led by active clinicians. It's developed with leadership and quality focus in mind, and it implements and conducts research in the areas of patient safety and medication management. It supports an analytical decision-making style, and it's driven through application of statistics and epidemiological concepts. It's a hands-on and analytical approach that is, again, done in a very flexible way online. And it can all be completed in 2 years of part-time study. So that is a very quick overview of the Masters of Patient Safety program curriculum. I now have the distinct and absolute joy of introducing Dr. Robin Harvan, who is our Director of the Health Sciences and Leadership Studies here, as well as the Master of Health Sciences and Academic Studies. Robin, please join us. Thank you.
And thank you, Mike. It's a pleasure to meet with all of you and talk with you a bit about 2 additional options that we have here at MCPHS University. The first of which is another option for master's level education, and that's the Master of Health Science. The focus of our Master of Health Science is academic health sciences. So I'll be talking a bit about that because that is a focus in health professions education, and for those who are interested in pursuing careers in education in the health professions. And then that'll culminate with sharing with you some information about our Doctorate of Health Science in Leadership Studies. So let's begin with the Master of Health Sciences program. Now this is a program that is designed to prepare and advance educational leaders and scholars in health professions. The intent of this program is to focus on the vision for the 21st century. And many of you are familiar with, as Mike was talking about, the Institute of Medicine and the work that they have certainly done in leading us into the 21st century, which began with To Err Is Human, and then their second report in the quality series, which was to Crossing the Quality Chasm. I had the pleasure of serving on the committee that wrote the third report for the Institute of Medicine, and that was in 2003. That third report was Health Professions Education, A Bridge to Quality, and it provided a foundation and a vision for the future of health professions education. This program does build on that vision. Even though that report is now 10 years old, it still rings true in the literature with regards to visioning for education in the health professions in the 21st century. So promoting excellence in teaching and learning certainly is a part of the mission. It is the mission of this program. Very much in linking, translating theory to practice. In this program, expanding the evidence base of health professions education so that there is a focus in this program of our candidates for the master's degree to become educational leaders and scholars and contribute then to the evidence base in health professions education. So linking education, research, and practice in the transformation of healthcare systems would be the ultimate vision and the ultimate goal of preparation in this program. The program is designed for working health professionals, again, who are interested in advancing their careers in academic health sciences. What is very nice about the cohorts in the program is the interprofessionality, the multidiscipline nature, the rich variety of the health backgrounds, different voices, different perspectives. This creates a truly rich and diverse student experience. This is a competency-based program like many of our others here, a 36-credit program, part-time completion in 2 years, with a flexible online format, so it's education, your pace, your time, your schedule. And there are some limited on-campus requirements that we can certainly talk about should you have some interest in this program. Again, this is focused for educators and leaders in health professions schools. They could be, you could have disciplinary training in medicine, public health, nursing, any of the allied health professions in order to qualify for admission to the program. Graduates then are prepared upon completion of the Masters of Health Sciences program to serve as faculty, to serve as department chairs or deans, as curriculum coordinators, as clinical training directors in academic institutions. Also in healthcare institutions as staff development coordinators, as training directors, and as well continuing education professionals in healthcare organizations. These are the courses in the program, and as you can see, of the 36 credits of the MHS, the Masters in Health Professions, there is a focus on education across the higher education spectrum, because we know that academic health professions educators can work at health professions institutes, at community colleges, at four-year academic higher education institutions, as well as onwards and upwards. There is also a focus on the educator competencies in academic health sciences, as well as interprofessional core competencies for health professionals, which is a major focus as we launch into the 21st, as we have launched into the 21st century, is team-based care. There's also then the very basics, if you would, of classroom, of clinical, and of simulation learning for the health professions, and preparation of lesson planning, of course development, and implementation and evaluation. And then there's health professions program development, curriculum development, of evaluation, as well as accreditation and preparation for accreditation. And a course on leading programs, leading departments, leading schools in the health sciences. And then finally, scholarship and research in academic health leadership. The faculty in the program will be bringing panels of expertise to the table, to the online environment. And you'll be meeting with a variety of professionals from across the country who have expertise in each of these areas. So our faculty directors of the courses will have a menu of additional expertise to share with you. This then culminates with, this program culminates with the capstone project, as well as then a residency seminar requirement. So that's our academic health sciences, Masters of Health Sciences program. And that brings me then to the Doctorate of Health Sciences and the overview of the doctorate. So regardless of which master's degree program you have already graduated from, or if you've graduated from one of the MCPHS University Health Sciences program, the question is a doctorate in your future? And if it is, consider the Doctorate of Health Sciences program. This is designed to refine your leadership skills of both health educators and others in academic and clinical settings, but it also provides a unique online competency-based program that is competency-based from the National Center for Healthcare Leadership and the Healthcare Leadership competency model. So candidates from across the healthcare spectrum can apply for this innovative interprofessional program. Again, there's this rich multidisciplinary environment of the backgrounds of health professionals to be part of your cohort and group study. And there's therefore a diversity of perspective that creates a truly interprofessional experience. And the DHS does focus upon research and scholarship and culminates with a dissertation. The DHS prepares transformational and visionary leaders in either the academic healthcare industry. So this would be places of employment such as academic health centers, universities, colleges, community colleges, schools of health professions, or the selected concentration of healthcare industry leadership, including healthcare delivery environments, organizations, pharmaceutical and biotechnology organizations, public health organizations, healthcare consulting, health management systems, insurance, patient advocacy, those in the legal, the policy, and the regulatory settings. Just like our other programs here at MCPHS Online, we have a flexible format meeting the needs of working professionals, offering required and elective courses in flexible online format. There are 2 in-person residencies that are required as part of the program, but there are only 1 week summer residencies, and this is at the time of the dissertation process, at the proposal and phase and qualifying exam phase of dissertation, and then following up with the defense of the dissertation. Candidates then enrolled in the DHS program will be exploring the health sciences through a variety of modalities. And by that it is meant that there are different modalities that we will be, that you'll be exposed to in the program. And these are learning modalities and learning techniques that are online based. So we take into account differences in learning styles, multiple intelligence, preferences in pacing and practice, as well as then different instructional techniques. And those might be techniques that focus on skills of daily living, on the job, because we know that increased practice and application does lead to increased retention of skills, as well as greater independence and flexibility in performing a wider range of these everyday tasks. We'll also focus on work-based learning in your coursework. And we know that work-based learning uses common work-related situations. So you'll see online situational scenarios, real workplace problems, actual workplace materials to frame the instruction and to practice the leadership skills. There's also problem-based learning, and with problem-based learning, students use problems they're facing or perceive in the world around them as a basis for acquiring new leadership skills. Thematic learning you'll see in your online coursework, lessons focused and activities focused around some general themes. And you'll also see group work, teamwork, and group work. You'll have access to multidisciplinary electives at the oldest institution of higher education here in Boston. You'll develop research methods and applicable solutions to address the challenges of health sciences, either in education or in administration. And you'll have access to cutting-edge information using our library resources developed by dedicated personnel with one of the largest medical product libraries in the country. Successful completion of the program will include the comprehensive dissertation qualifying exam, followed by the completion of all core and concentration courses. And this is what the program looks like in its curriculum map. The core courses are 33 semester hours, and these are in leadership studies. The concentration courses, 15 semester hours in either academic health sciences or in healthcare administration. And then 6 credits of electives, which can be any online graduate courses here at MCPHS University or any transfer graduate courses. 6 credit of transfer would be accepted. And these are the courses in the program: qualities and characteristics of leadership in healthcare, leading with values and direction in healthcare, managing crisis, conflict, and change in healthcare, leadership policy and political savvy in healthcare, and stakeholder communications and engagement in healthcare. Those 5 courses are based on the core competencies I've previously mentioned. That's followed by dissertation design, qualitative and quantitative research methods, and of course, proposal development seminar, and then the dissertation seminar. Candidates pursuing a concentration in academic health sciences will investigate the unique challenges facing academic sciences and health professions education, and their research, their dissertation, focus would be, of course, in this area. These are the concentrations: the concentration in academic health sciences and the applicable courses, and the concentration in healthcare administration and the applicable courses. And now we have an opportunity to open this discussion for questions. So we will be shifting then to our panel of the three of us who have spoken with you today, and we would welcome the opportunity to address your questions.
So do we have any questions? You're, I believe, free to go ahead and type them into the chat box.
Just move the Q&A box over.
Again, we're here and available if you have any questions about any of the programs. Here we go. Emily, so the DHS looks like a great program. Where do I get information on the semester dates?
As far as the fall, we offer courses in the fall, in the spring, and in the summer sessions. So being a flexible program, you have the opportunity to take as many courses as you feel you can fit in balancing your work life, your home life, your personal life, as well as your schools and graduate study then. The semesters are generally 15 weeks, beginning in September or beginning in January for 15 weeks, and the summer is 10-week sessions that begin in May, and I hope that addresses your question.
If you go to our website, you can see the specific calendars for each year that have the dates. I hope that helps, Emily.
Any additional questions? You're welcome. Just in case you've joined us, we're open now for the Q&A. I know you have the option of going to other sessions and then rejoining the session, so that's where we are at this point, is questions and answers. If you've had the chance to either to listen to any of our presentations regarding our programs, or if you've had a chance to look at our website, that provides program descriptions of the programs. If you have any questions, we're here to answer those.
One question we typically get in the regulatory affairs program is whether there's a requirement or opportunities to do internships. We don't have a requirement to do internships, and part of that is based on the fact that we have catered this program over 15 years to working professionals in regulatory affairs in the industry, so they don't need to get an internship. But I will say that many of our students go and do internships either between semesters or even during semesters on a part-time basis. And that is something that we have both a career center that can help you with and our network of alumni and current students.
So Dave, I think you bring up a really good point, and that's one of the questions I typically get is, what do you do to support us in terms of career as we're going through this program and working our way towards a different profession, if we're changing professions or if we're already in healthcare, how are you going to support our career aspirations? And Dave mentioned the Center for Professional and Career Development, which works with our students here to not only improve interview resources, resumes, but also to identify specific areas where the students may focus. And so that is something that has been extremely helpful for our students as well, and it's something that's always worthy of mentioning.
And a question that the Doctorate in Health Sciences often gets as well is with regards to the dissertation in particular. Throughout the process of the time that you are with us, we're working with you to explore a variety of different areas of focus for the research. And what's nice about the selection then of your dissertation committee is you'd have the option of selecting dissertation committee members from our faculty, but you may also include anyone in in the nation, as well as potentially globally, who has expertise in your area, can serve as a member of your dissertation committee. So that is wonderful as well, because once you are at the dissertation phase of the program, then independently you are working under the guidance of this committee who's mentoring you throughout the process.
I'd like to remind folks who are attending that if you have any questions, feel free to use the chat box on your screen to go ahead and send those to us, and we'll answer them. I just want to expand on that, Robin. I mean, in our program in Reg Affairs, if you choose to do a thesis, I mentioned this briefly in my presentation, you can choose a thesis advisor who, for example, is a working professional at a local company or a company anywhere in the country, as long as they have expertise in your area. And then your committee is made up of that person and let's say 2 folks who are either adjuncts or full-time faculty here at MCPHS. And that allows you to get, again, very much first-hand, real-world experience.
Right. Yes.
And that, Dave, I think brings up another good point to follow up. I think that one of the things that is important also for students to know is the advising relationship that we have with our students is very much, you're looking at us. We're here to work with you very specifically, and we make ourselves available in a number of different ways. And we understand that online doesn't mean that we're not existent. It means that we're here to help you, and we work in a number of different ways to do that, whether it be just by a phone call, we can meet by video conference. There are other ways that, we work online, we understand some of the complications of learning online, and we're certainly here to help you. And so that's something that I think is important for all of us. And I know that it's true for the people sitting here, and we represent MCPHS Online and MCPHS University in that respect.
Just as an example, we had a master's student who actually finished with her thesis, and she was an MCPHS Online student. I actually was her thesis advisor. We never met face-to-face until she did her defense, right? She came in to practice her defense 1 week beforehand and then came in to finalize that. So we do provide both the technology and the availability to allow folks who are working professionals to complete these programs. I'd also want to point out that we're available for questions and answers when this session ends. Don't hesitate to email the university and the folks who work in our admissions office to get information, and oftentimes they'll pass those questions on to us so we can talk to you and help you answer your concerns and questions. Never assume anything when you read the information about our programs. Email us and find out if you believe you're interested and are concerned about a particular admission requirement. Email us to find out more.
Yes, and I'd also like to add about the Doctorate of Health Science. There are very few Doctorate of Health Sciences programs in the country. In fact, if you, no matter what browser you might use, if you were to Google or any Doctorate of Health Sciences programs, there may be a handful, of which we are one of the top 3 that will show up on any browser. And that's because there are very few, and this is a very unique program in addressing then the potential for graduates with a doctorate in health science.
Again, I would encourage you to stay on the line if you want to chat with us. It's just give us questions via the chat box, or if not, again, after the session, feel free to email us with questions.
And I believe our chat box is still going to be open for some time after this live part of the presentation. In fact, it will be open until 7 o'clock tonight. So you can continue to move back and forth as you're looking at programs. We certainly thank you for joining us today and learning more about the programs we have here at MCPHS University.
Again, thank you from all of us, and enjoy the rest of your stay at this online session.